Introduction to nurse prescribing. Introduction to the module. The introduction to nurse prescribing involves several important pieces of legislation. It also includes important information regarding nurse prescribing in the United Kingdom. The following topics will be explored in this module. Necessary skills of prescribing. Nurse prescribing. Prescribing in modern medicine. Factors leading to nurse prescribing. Nurse prescribing in the UK. Nurse prescribing across various UK regions. British National Formula, BNF. Nurse prescribing across the world. What is prescribing? Prescribing involves a medical practitioner who will advise or authorize the use of certain medications or treatments. Prescribing can entail the provision of medication as well as non-medication treatments. You as a prescribing nurse will encounter both on a daily basis. It is therefore very important that you are fully trained and qualified to provide these services to patients. Necessary skills of prescribing. While your qualifications are the first thing you would need for prescribing, there are a range of other skills you must have as a prescribing nurse. These include understanding effectiveness of medications for various conditions, understanding the cost of medications, understanding the individual needs of the patient. These three variables are the cornerstones of good prescribing in modern medicine, and we'll be covering these skills in depth in this course. Types of prescribing in modern medicine. For now, let's look at the types of prescribing in modern medicine. So, what prescriptions can the modern nurse provide to a patient? In general, a distinction can be made between two types of prescribing: non-medical prescribing, independent prescribing. Non-medical prescribing. Non-medical prescribing is a term used in modern medicine to refer to prescribing that is not done by a general practitioner. However, this kind of prescription is provided by a health professional that has a certain level of expertise. For example, a prescribing nurse who works in family planning could provide a prescription for a contraceptive pill. As family planning is her expertise, prescribing contraceptives falls within that framework. Independent prescribing. The prescribing nurse can also be an independent prescriber. The independent prescriber is responsible for assessing patients with both existing and undiagnosed conditions. This nurse will also prescribe to manage the condition in question, diagnosed or undiagnosed. An example of an independent prescriber is a nurse practitioner. A growing role. Nurse prescribing is starting to play a big role in the United Kingdom. Nurse practitioners and non-medical prescribers are able to handle common conditions and can therefore be a vital cog in the hospital as well as the common doctor surgery. Factors leading to nurse prescribing. There are a number of reasons why nurse prescribing has become increasingly popular. These include quicker access to medications for patients, lower cost for the NHS, high level of knowledge among nurses within their field of expertise, which benefits their practice in numerous areas, better satisfaction and confidence among patients. Nurse prescribing in the UK. Nurse prescribing is now a mainstream qualification in the United Kingdom. To become a nurse prescriber, the following criteria must be met in the United Kingdom. To become a nurse prescriber, you must have the appropriate training. This training must be provided by a course provider who has been accredited by the Nursing and Midwifery Council, NMC. This council also recognizes the qualification. Nurse prescribing across various UK regions. Nurse prescribing legislation may vary depending on the region in the United Kingdom. Here are some examples of how legislation could vary as well as some similarities. Legislation for nurse prescribing was also passed in Scotland, Wales, and Northern Ireland. Regions may require different qualifications than England. Wales has courses that are funded by the Welsh Assembly Government. For Northern Ireland, guidance for prescribing nurses is provided by the Department of Health, Social Services and Public Safety, DHSSPS. Scotland also has its own range of prescribing policies. While most of these policies are similar across the board, differences must be checked for anyone who is considering working in Northern Ireland, Scotland, or Wales. British National Formulary, BNF. There are other organisations, boards and resources you must be familiar with as a prescribing nurse. One of these is the BNF, which stands for British National Formulary. In fact, anyone responsible for prescribing or distributing medications will use this resource on a regular basis. The British National Formulary contains a wealth of medication information. It is the most up-to-date resource on medication in the United Kingdom. Therefore, it proves a valuable resource for the selection, prescribing, distributing and even the administration of various medications. Nurse prescribing around the world. While prescribing nurses are well known in the United Kingdom, this is not the case for the rest of the world. In some countries, nurses can only administer medications, but not prescribe them. However, an increasingly large number of countries is adopting nurse prescribing laws. At the moment, 13 European countries have adopted nurse prescribing laws. There are also specific regions where nurses can prescribe, including the Canton Vaud in Switzerland. Summary. The cornerstones of prescribing are effectiveness, cost, and patient choice. Prescribing nurses can provide non-medical prescribing or independent prescribing. Courses for nurse prescribing must be accredited by NMC. The British National Formulary provides detailed information on the selection, prescribing, distributing, and administering of medications. Guidelines for prescribing nurses can be different for Scotland, Wales, and Northern Ireland.